guys, welcome to Podcast Meant. The topic of discussion of this video or podcast is ENT case sheet. In this case sheet, I'm totally going to discuss about history taking and general physical examination. But this podcast only will contain the subheaders under which the history is taken, general physical examination is done, and as well ENT examination is done. So the further details about general physical examination, history taking and ENT examination will be discussed in detail in further videos. So coming to the history taking involves again the six side headings that we normally take in any other history taking. Those are demography of the patient, chief complaint that the patient has come with, history of present illness, history of past illness, personal history, family history. Here I want to mention small thing in demography of the patient. Gender of the patient here is important, as JNA is more common in males, which is juvenile nasopharyngeal angiofibroma. Otosclerosis is more common in females. And coming to the occupational hazards in ear, nose, throat, case or vocal nodules in the people who shout so much and who use their voice so much. For example, in singers, in traffic police, etc. And laryngocele is more common in trumpet blowers, where they will apply more pressure into the instrument through their larynx. So there can be a laryngocele. And coming to the next thing, mining industries where septal perforation is more common. Next, coming to the residence of the patient, a small example that describes this, rhinoscleroma is more common in West Bengal, Jharkhand, Orissa and northeastern states. And sickle cell anemia, thalassemia, which presents as epistaxis, is more common in Bihar, Madhya Pradesh, Karnataka belt. Then this is about a small detail about demography of the patient. Then the remaining are the same, like chief complaint, history of present illness, past illness, personal history and family history. Coming to the general physical examination. Under general physical examination, these four are the things that you should mention, which are conscious. If the patient is conscious, coherent, cooperative, well oriented with time, place and person. This is a thing that you should mention. And mention firstly in general physical examination. Then you'll go with head to toe examination, where you will examine everything head to toe superficially, not in deep. Then coming to the where head to toe examination also have this famous mnemonic, which is pickle, palar, icterus, cyanosis, clubbing, koidonychia or condition of nails, lymphedema. But the most important thing that you should remember here is it is generalized lymphadenopathy and pedal edema. Anyone know what is generalized lymphadenopathy in particular? Generalized lymphadenopathy is a lymphadenopathy where more than two lymph node groups which are non-continuous, excluding superficial inguinal lymph node group. This is called generalized lymphadenopathy. It is lymphadenopathy or enlargement of more than two lymph node groups which are non-continuous, excluding superficial inguinal lymph node group. Why does this superficial inguinal lymph node group excluded? Because due to barefoot walking, we normally may have this few enlarged lymph nodes in that region, superficial inguinal region. So these are excluded. So this is called generalized lymphadenopathy. And we should mention it is pedal edema. Normally people using that whatever the mnemonic as pickle, mnemonic as to remember these things, they tend to mention lymphadenopathy and edema. But in ENT in particular, please be careful about it. Mention it as generalized lymphadenopathy and pedal edema. Then you'll be asking after head to toe examination about other systemic examination. Mainly, we are concerned about CVS and respiratory, cardiovascular system and respiratory system, which are more connected towards ear, nose, and throat. Then after that, we'll go with checking vitals, where we'll be taking pulse rate, respiratory rate, checking blood pressure, temperature. Just say if the patient is febrile or febrile, and if thermometer is available, you can check it out. If the fever is if fever is the main complaint, along with the other complaints, you should check temperature properly as well. Then coming to the main case sheet of ear, nose, and throat, where in ear examination, there is no percussion and auscultation. You'll be just inspecting and palpating it. So the headers under which ear is examined is first examination of preauricular region, where preauricular region is the region in front of the ear. Then about the pinna, then the examination of pinna, where pinna is the external ear. Then you'll be examining for tragal sign. Tragal sign is palpation of pinna to elicit any tenderness, which will be explained in the further videos. Then is post-auricular region examination. Then it is mastoid tenderness test. It is also called three-finger test. Then after that, you'll be examining external auditory canal with the help of otoscope. Then after that, you'll be examining tympanic membrane. Here about tympanic membrane, you should be sure if there is any perforation and what is site of the perforation. Then after tympanic membrane perforation, you'll be examining for facial nerve. Facial nerve examination should be done. Then after that, fistula test is done. Then after fistula test, you'll be doing tuning fork test, which will include three other tests, which are Rennie's test, Weber's test, absolute bone conduction test. And one more thing that you should remember here is while presenting the case to a professor, don't present 2 ears simultaneously. Right ear examination and left ear examination should be different. Mention the right ear and left ear separately. That gives the overall overview of the ear examination. Then next we'll go with nose examination. In nose examination, first, as usual, right and left you have to divide, and like right nostril, left nostril, like that you have to divide and examine. Coming to the external first thing is external framework. Then the next thing is vestibule examination. Then the next thing is anterior rhinoscopy with the help of tudicum speculum, which you will be explained about in the further videos. Then you'll be examining the medial wall of nose. Then we'll be explaining the lateral wall of nose, then floor of the nose, then superior aspect, then nasal mucosa. Then you'll be doing a probe test if there is any polypoid mass, mainly to differentiate turbinate. Then differentiate turbinate, consistency, mobility, if it bleeds on touch, tender on touch, if the probe if the probe is movable all around the anterior aspect. All of this we will check under probe test. Shall we repeat what did we discuss? External framework, vestibule examination, anterior rhinoscopy, medial wall examination, lateral wall examination, floor examination, superior aspect examination, nasal mucosal examination, then probe test. Now coming to the functional tests. Functional tests include 3 C tests. What are those? Cold spatula tests, Cottel's test, cotton wool's test. These are the 3 functional tests that we'll be doing in case of nose examination. Then after that, we'll be doing posterior rhinoscopy, where you'll be introducing a instrument into your mouth to see the posterior wall of nose and posterior aspect of nose. So after posterior rhinoscopy, we'll be eliciting for any paranasal sinus tenderness. Where sphenoid sinus cannot be elicited, frontal, ethmoid and maxillary sinuses can be elicited. Then by this we'll we complete nose examination. After nose examination, we'll go with throat examination, where throat examination involve examination of lips, angles of mouth, buccal mucosa, gingivo-buccal sulci, gingivo-labial sulci, gingiva, teeth, retromolar trigone, flora of mouth, tongue, hard palate, soft palate, anterior tonsillar pilus, tonsils, posterior tonsillar pillars, posterior pharyngeal wall. Then we'll go with indirect laryngoscopic examination. Okay, it is so hectic to listen to all of these things at a time, but just repeat the video or podcast again, and try to point out it in your own mouth and buccal cavity how examination goes with your finger. I'm not saying to touch everything that I'm saying now. Just imagine where is it. You'll be able to remember it more well. Lips, angles of mouth, buccal mucosa, gingivo-buccal sulci, gingivo-labial sulci, gingiva, teeth, retromolar trigone, flora of mouth, tongue, hard palate and soft palate, anterior tonsillar pillars, tonsils, posterior tonsillar pillars, posterior pharyngeal wall. Then at last it is indirect laryngoscopic examination. So here by this we complete the throat examination. After throat examination, we'll be doing neck examination, which is not a very part of ENT, but there is a need to do it. Like if we'll be seeing for any swellings, ulcerations, any visible veins, or any abnormalities of the neck in the patient. So after neck examination, we'll be coming to one provisional diagnosis. Then we'll be assigning investigations that should be done, lab investigations and clinical investigations, then radiological investigations. Then we'll be treating the patient. This is how case sheet, ENT case sheet is done. In all the videos that I've explained so far, I have always discussed about what are the headings under which it is discussed and how actually it should be done. But the thing is, it is not only about the exam or practical or viva that we are going to give to the professors. It's about how you will handle a patient and real case scenario. Just as long as you are preparing for the exams and this, the main thing that you should learn is how to exactly do it on the patient. Not just knowing all of these things will do anything. You should practice it on the patient, take details, history, examine the patient. Then only you will be able to perfectly treat a patient in the future. This exposure to patients, whatever is going on in the hospital, in the postings, I think it is very important to get exposed to patients. So everyone who are listening to this podcast, I wish you will be able to you will try to participate in history taking and general physical examination that postings that you are posted in. So with this, I end this podcast. In the further podcast, I'll be explaining more in detail about the symptomatology, examination and other topics of ENT practical parts. So thank you.